I think community is when you actually live close enough to one another and openly enough with one another where you really understand each other's desires, needs, hopes, and dreams, and you're willing to enter into that and partner with people to help them achieve those things. I think that's the best of community.
Gundersen Lutheran is a community asset. It's been built along with the community over 100 years. And so anything that we would do going forward, we want to make sure that it doesn't fundamentally change what has been a really great community partnership over decades.
Gundersen Lutheran is the heart of the community. Nearly every person in the area has had their life touched or knows a loved one, friend, or neighbor who has had their life touched or saved by the medical excellence and personal care we provide here. And as we embark on the next phase of our mission with our Campus Renewal project, we rededicate ourselves to supporting the health and well-being of our entire community.
I didn't plan on getting cancer. Nobody does. But I was lucky enough to get a good kind of cancer, if there is such a thing. I was lucky enough to have great people to handle it. And, it all worked out. In my case, this hospital saved my life. My doctor saved my life. By my eyes, and I've been in a lot of places in this hospital over many years. And by my eyes, Gundersen Lutheran's done a great job of maintaining what it has. But no matter how much and how well you maintain, the day comes when you have to replace. And it's time to replace. I know La Crosse and area will be proud when they see what's going to come with this campus renewal.
When we talk about the hospital addition here at Gundersen, is a 50-year investment. And many of the people that invest in it may not be the ones that reap the most benefit. So I think it reflects again on the generosity of the community when they're willing to invest in future generations and their ability to receive the kind of care that we want them to have, right? The kind of life-saving, compassionate, family-building, community-building care that they can get at Gundersen when they're willing to invest in something that's bigger than themselves. Because it's not going to be 30 years from now that we find ourselves falling behind if we don't do it. It's going to be 5 years, 6 years, 7 years, 3 years. It's going to be something. We can see it, and we have to do it because the cost of waiting is much greater than the cost of going forward right now. And so it's a great thing when you can wrap up the needs of future generations with the needs you have right now. And I think this is one of those cases we can do that.
It's hard to imagine the unthinkable. We never know when we might need the latest advanced treatment or an innovative life-saving procedure. In fact, we hope we never need those things. But if we do, it's a comfort to know we can receive world-class care with extraordinary outcomes right here at home.
We got a call from my nephew saying that Kyle had collapsed. I took a look at him and I knew it wasn't his asthma. They took him to the CT room and they scanned his brain and found that he had a very large clot in his brain. Stroke in a 14-year-old does not happen very often. Throughout the whole thing, we had reassurance from the support staff, the social workers, the ER staff, the neurologist. It was awesome. It was like a whole family of people coming together, working as a team to reassure and to let you know that your child is getting the best care right now. And they're going to do whatever they can to make it better.
The face of mental illness looks like everybody else in the world. There is no specific face. It can be anybody, and it touches so many people, and until you start having the discussions with people and being open about our own situation, everybody is touched in some way. When my daughter passed away on November 19th, 2007, she was diagnosed with bipolar disease. She was very open about the fact that she had mental illness, and because she's not here to talk about it, I've become her voice and her advocate. With the campus renewal, I was even on the focus group that was recently held to get the community's response into what the campus renewal project in regards to behavioral medicine needed to really step up to the plate and be a forerunner in care of mental health. They are the community, and they're here making a difference, but they're also out there listening to what people are saying, what they need to do to change, to make this the best place we can. We can make healthcare better by listening to the community.
A hospital building is a tool to use to build greater health within a community. And that's how we're viewing the Campus Renewal Project in all facets. It's not just a nice, shiny building. It's a tool to help the people who are providing the care do a better and better job at doing that. And it goes far beyond the walls of just Gundersen Lutheran as a clinic. This project is the future of this community. I look at it as an opportunity to contribute to something that will greatly impact the area, and I can say I'm part of that. And I can hold hands or be arm in arm with other folks throughout the many counties that we serve and say, you know what, we did this together.
It is clear to us that if we don't do something to improve the facilities, as technology becomes more and more important, as patient privacy is such a big issue, we need to do this, because if we don't, we could still survive and there'd still be a hospital called Gundersen Lutheran in La Crosse, Wisconsin. It just wouldn't be one of the best hospitals in the country and in the world. It wouldn't be. And I think the community deserves more than that.